Assalamu alaikum. Today I will teach you how to perform cardiovascular examination. Cardiovascular examination is very important for undergraduate as well as for postgraduate resident. So first of all, you should approach the patient from the right side. You will ask the patient, like you will take the consent from the patient. I will take the consent. Just look at me. मेरा नाम डॉक्टर फैज़ान है. आपकी बीमारी की सही तशखीस और इसका इलाज करने के लिए मैं आपका मायना करूंगा. दौरान मायने आपकी कोई तकलीफ नहीं होगी. अगर दौरान मायने आपको कोई तकलीफ होती है तो आप मुझे बता सकते हैं. जी. After taking the consent, you should explain what you are doing with the patient. Like you will explain how you will examine this patient. मैं जो है आपका कमीज़ थोड़ा ऊपर करूँगा. उसके बाद मैं आपका दिल का तफसील से मायना करूँगा. इसके साथ साथ आपके जो यहाँ पे गर्दन में रग होती है उसका मायना करूँगा. और इसके साथ साथ आपका ब्लड प्रेशर और आपके नब्ज़ का भी मायना करूँगा. After explaining the procedure to the patient, you will start with examination.
Before proceeding to the cardiovascular examination, we will take a start from the hand. In the hand, we will look for clubbing, chylonychia, cyanosis, splantar hemorrhage, ossular nodes, Janvey lesions, xanthomata, and tobacco stain. All these findings have a relationship with cardiovascular disease. Now we will check the pulse. We will look for the rate, rhythm, character of the pulse, what is the condition of the vessel walls, and we will check for the radio-radial delay. Is there any radio-radial delay or not? After the pulse, we will go to check the BP. In another video, I will teach you how to check the BP properly. Now we will go to the neck and will see the GBP status, either GBP is raised or not. Normally it is raised 3 centimeter above the clavicular line, but for that you should have lied the patient in 45 angle.
Before proceeding to the cardiovascular examination, first we will just thoroughly look at the patient. We examine the hand of the patient, we check the pulse of the patient, we check the BP of the patient, and we check also the neck veins, like we measure the GBP of the patient, that other GBP is elevated or not. You can also look general look of the patient. The patient is tachypneic or patient is too emaciated, like too weak, like the patient in cardiac disease, the patient are too weak, and sometimes the patient is dyspneic because of heart failure. So now we will proceed with the cardiovascular examination. So with the cardiovascular examination, we will properly expose the patient. By exposing the patient, we will do four things. First one is we will do the inspection of the patient. Second, we will do the palpation of the patient. In cardiovascular examination, most of the time we don't perform the percussion, but you can perform the percussion if you are suspecting pericardial effusion. And the last and most important things in cardiovascular examination is auscultation of the heart. And the different area I will teach you to do today how you auscultate the heart. Thank you.
While inspecting the patient, we will look for the shape of the chest and any deformities like kyphosis, scoliosis, lordosis, pectus excavatum and coronatum. We will look for visible cardiac impulse, other impulses such as epigastric, suprasternal and supraclavicular. We will look for score marks in the midline as well as look for the pacemaker or ICD is being seen or not. We will look for all chest. Now we will palpate the patient. We will palpate the apex bead by first locating the apex bead. It will located in the fifth intercostal space in the mid clavicular line. Now we will also mark the distance from the clavicles. Now we will palpate the apex bead and its character. It is stepping, heaving apex bead. Now we will check for the thrill. Is there any thrill or not? Now we will also check that it's either coincide with pulse or not. Now we will go and check for the left parasternal heave or left. Place the flat of the right palm in the left parasternal area and feel by giving gentle sustained pressure. Presence of left parasternal heaves indicate right ventricular hypertrophy. Now we check the epigastric pulsation and now we will check the palpable P2 are present or not. We don't perform percussion in cardiovascular examination except when we suspicious of pericardial effusion.
So the last and most important of cardiovascular examination is auscultation of the heart. In the auscultation of the heart, we will auscultate the different heart sound S1, S2, S3, and S4 in different area of precardium. Like this is the mitral area, we will auscultate here. We will auscultate in tricuspid area. As well, we will auscultate in pulmonary and aortic area.
Now we will start auscultation by ausculting the first and second heart sound in all area. Feel the carotid pulse at the same time while you auscultating the heart. We have auscultate all the four area, mitral area, tricuspid area, aortic and pulmonary area. We will also check is there any added sound or not like pericardial rub, opening snap. We will also check the mitral regurgitation murmur by asking the patient to be on sides. Now we will here check the aortic stenosis murmur by setting the patient and leaning forward. We can also auscultate the patient from the back to check for any pulmonary edema which is caused by congestive heart failure. And the ED you can also check for the splenomegaly as well. Thank you.
This is the complete cardiovascular examination. After examination of the patient, you will properly cover the patient and will say, thank you so much, Jazakallah, thank you.